Thanks, Ron. Well, back with us now, Merritt Bates Thomas of the Green River District Health Department. And we are going to talk about several things, but not the least of which is kind of managing diabetes, and that you offer some help.
We do. We've got a couple of programs that actually continued right through COVID, and we're in a position to be able to go virtual. And so things proved to be pretty successful for us.
Well, that way more people can dial in. What are some of the points that they're going to learn, important points in managing diabetes? Because it is a disease that has to be managed on a daily basis.
Right. Well, a couple of things. So we've got our Healthy Living with Diabetes program, and we had been working, our state program had been offering a pilot in another part of the state. And when the pandemic began to shut things down, the group quickly pivoted to a model where more of the sites like ours here in Green River District, our sites accredited and recognized through national organizations through our state program. We shifted to that virtual model and have now offered two very successful classes virtually. It's called Healthy Living with Diabetes. It's a comprehensive diabetes self-management education and support program. And the classes are broken up into 4 two-hour sessions, because sitting watching a screen for more than 2 hours, even with a couple of breaks, is just too much for any of us.
So true.
So they're learning everything they would be learning in person, and then we're either doing mailing the packets that they get at the completion of the class, or doing drop-offs, or they're picking up from us. So they get lots of goodies, lots of good educational information that we're supplementing, but we're finding that connecting virtually is just a great way to continue educating some people. Even post-pandemic, this model will likely continue. And then our Care Direct program, which is a self-measured blood pressure monitoring program that began before the pandemic, offered telephonic visits. In addition to that first in-person visit and the last in-person visit, what we found, people were hesitant to do those telephonic visits. And during the pandemic, that was a great way to connect and still meet some of those personal health care goals. One thing we all learned is you can't put your good self-care habits on the back burner. And if you do, you see problems begin to arise. So through Healthy Living with Diabetes and through Care Direct, people have a way of connecting and still taking care of things related to diabetes or to high blood pressure, and then working to be more successful with those self-management goals.
Merritt, can folks still join both of those programs?
Right, yes. Well, Care Direct, our blood pressure, self-measured blood pressure monitoring program, is ongoing, so people can opt in at any time. Healthy Living with Diabetes is that 4-class series, and likely our next class will not be until July. But anyone interested in either or both programs can call 270-686-7747 and ask to speak with me, or ask for more information about Healthy Living with Diabetes, and we'll get you connected to that next available class or get you enrolled in Care Direct.
Merritt, as always, thank you so much for trying to make our community healthier.
Thank you. Good to talk with you, Angie.
You too. More lifestyles for you after this, right? Stay with us.